Hi everyone, this is Denora Millhouse. Would you be willing to spend 1 hour helping to save lives? According to the American Red Cross, every 2 seconds someone in the United States needs blood. We know that blood is the life force flowing through the veins of every living being on the planet, and it is so vital that hospitals and blood banks can never have too much on hand. So today I will persuade you of the importance of becoming a blood donor. We will discuss patients that need blood, blood types, type of blood donation, the donation process, and eligibility and any risks associated with blood donations. So first, let's look at the patients. Every day, a blood donor helps patients of all ages, and those patients include, but are not limited to, trauma patients, such as accident and burn victims, patients that require heart surgery and organ transplants, and those battling cancers and chronic diseases. So as you can see, that's a wide variety of people that are in need of blood donations. So even if you don't know anyone personally, it's still rewarding to know that your blood donation can help save a life, even if that life is a stranger. Next, let's talk about the different types of blood and the blood donation. So there are 6 different types of blood: A positive, A negative, O positive, AB positive, and AB negative. And the most common type of blood donation is the whole blood donation. During that process, a pint of blood is extracted from the donor. That blood is then separated into components. The components are red cells, plasma, and platelets. So let's look at the platelet donations. Donated platelets are commonly given to people with leukemia, people receiving chemotherapy, and babies with severe infections. Those platelets help stop bleeding by clumping and forming plugs or clotting in the blood vessels. Next, you have the double red cell donation, and that allows you to donate twice the amount of red blood cells than you normally would during a whole blood donation. Red blood cells deliver oxygen to the entire body. People with a medical need for only red blood cells includes those with severe blood loss, such as after an injury or an accident, and those who have anemia with serious symptoms. And last, you have your plasma donation. And during that donation, the liquid portion of the blood is collected. Plasma helps blood clots and contains proteins and other substances such as electrolytes that help the body function normally. Plasma is commonly given to people with liver conditions, burns, and severe bacterial infections in their blood. So now we will take a look at risks in donating blood. Blood donations is safe, according to the American Red Cross. New sterile, disposable equipment is used for each donor, so there's no risk of contracting a blood-borne infection by donating blood. If you are a healthy adult, you can usually donate a pint of blood without endangering your health. Within 24 hours of a blood donation, your body replaces the lost fluids. And after several weeks, your body replaces the lost red blood cells. To be eligible to donate whole blood, plasma, or platelets, you must be in good health, at least 16 or 17 years of age, at least 110 pounds, and able to pass the physical and health history assessment. Eligibility requirements differ slightly between different types of blood donation and from center to center, so check with your local donor center for specifics. So today, we have discussed the patients that need blood, the blood types, the types of blood donation, the donation process, eligibility, and risks associated with blood donations. Would you be willing to spend 1 hour helping to save lives? Become a donor and enjoy feeling the accomplishment knowing you're helping to save someone's life. If you're not eligible to donate, consider hosting a blood drive in your community or at your place of employment.